Researchers from Charité, Universitätsmedizin Berlin, the Max Delbruck Center for Molecular Medicine, MDC, and Freie Universität, FU, Berlin have studied the mechanisms of action of antiviral and anti-inflammatory drugs. Their findings, which have been published in Molecular Therapy, show that treatment effects were best with combination therapy involving both types of drugs. This treatment regimen also had the additional benefit of increasing the time window available for antibody therapy. SARS-CoV-2 infections continue to result in hospitalizations. According to estimates by the Robert Koch Institute, the current COVID-19 hospitalization rate is approximately 6 to 7 per 100,000 of the resident population. Hospitalized COVID-19 patients now have access to a range of drugs which can reduce the severity of the disease or, in the most severe cases, reduce the risk of death. Some of these drugs target the virus itself. Others fight the inflammation associated with infection. First-line treatments include monoclonal antibodies and dexamethasone, a drug with strong anti-inflammatory properties. Hospitalized COVID-19 patients who require oxygen therapy usually receive dexamethasone, a glucocorticoid which, for approximately 60 years, has been used to treat inflammatory conditions caused by an overactive immune response. In COVID-19, too, the drug has been shown to reliably dampen the body's inflammatory response. However, as the drug is associated with various side effects, including an increased risk of fungal infections, it should only be used in a specific and targeted manner. Researchers from Charité, the MDC's Berlin Institute of Medical Systems Biology, BIMSB, and FU Berlin have now studied the mechanisms of action of both types of treatment. As not all lung compartments can be studied using lung tissue samples obtained from patients, the research group's first step last year was to search for a suitable model. That task fell to co-last author Dr. Jakob Trimpert, a veterinarian and research group leader at the FU Berlin's Institute of Virology, who subsequently developed COVID-19 hamster models. As animals which both contract the same virus variants as humans and develop similar disease symptoms, hamsters have proven the most important non-transgenic model for the study of COVID-19. Symptoms and progression, however, vary between different species of hamster. While symptoms usually remain moderate in Syrian hamsters, for example, Roborovsky hamsters will develop severe disease reminiscent of that seen in COVID-19 patients requiring intensive care. In the current study, we tested the effects of single and combined antiviral and anti-inflammatory therapies for COVID-19, meaning we used the existing models with monoclonal antibodies, dexamethasone, or a combination of the two, explains Dr. Trimpert. Dr. Trimpert and his team also determined the quantities of infectious virus and viral RNA present in the tissues at various time points. This enabled the researchers to check whether and how viral activity might change over the course of treatment. Thanks to a detailed analysis of various COVID-19 parameters, which is only possible in an animal model, we were able to improve our understanding of the basic mechanisms of action of two important COVID-19 drugs. Moreover, we found clear evidence of the potential benefits associated with a combination therapy of monoclonal antibodies and dexamethasone, says Dr. Trimpert. Individual cells obtained from a particular sample were loaded onto a chip, where they were first barcoded and then encapsulated into minute droplets of aqueous fluid. Once prepared, the single cells underwent RNA sequencing, a process used to establish the sequence of genetic building blocks which a cell has just read. Thanks to barcoding, this RNA is later identifiable as originating from a particular cell, enabling the researchers to determine cellular function at the single-cell level with a high degree of accuracy. We were able to observe that the antibodies are effective at reducing the amount of virus present, explains Dr. Weiler. He adds, "This was not much use in our model, though. This is because it is not the virus that damages the lung tissue, but the strong inflammatory response triggered by the virus. This anti-inflammatory exerts a particularly strong effect on a specific kind of immune cell known as neutrophils," says the study's co-last author Dr. Geraldine Nuales, research group leader at Charité's Department of Infectious Diseases and Respiratory Medicine. Neutrophils are a type of white blood cell responsible for mounting a prompt response to viral and bacterial infections. She continues, "This makes the drug extremely effective at preventing an escalation of the immune response. The best treatment outcomes were achieved when the researchers administered a combination of antiviral and anti-inflammatory treatments. This type of combination therapy is not included in existing clinical guidelines," emphasizes Dr. Nuales. In clinical practice, dexamethasone is only used once a patient requires oxygen therapy, i.e., at an extremely advanced stage of the disease. Its use in combination, however, opens entirely new treatment time windows. This new approach must now be evaluated in clinical trials before it can be adopted in clinical practice. Make a difference. Sponsored opportunity StorySource. Materials provided by Charité Universitätsmedizin Berlin. Note: content may be edited for style and length. Key benefits of dexamethasone and antibody treatment in COVID-19 hamster models revealed by single-cell transcriptomics. Molecular Therapy, 2022. doi. 10.1016 j. YMTHE. 2022. 03. 014. Cite this page. Charité Universitätsmedizin Berlin. COVID-19 therapy. Better in combination than alone. How well-known drug can become a game-changer. Science Daily. Science Daily, 13 April 2022. ift.tt/kbridge9d. https://ift.tt kbrij9d. Accessed April 13, 2022. Thanks for watching. Please subscribe my channel for more videos.